This program, while curated to help you improve your health, contains general advice and should not replace the individual advice of your medical practitioner.
So fertility is just a reflection of our underlying state of health. They feel like their bodies are broken and that need to be fixed by someone or something outside of themselves. Women who have been put on the pill at 13, a year after they've had a period, perhaps to regulate their cycles, which is like my biggest bugbear in the whole history of the world, because it doesn't regulate your cycle, it just turns everything off. I actually would like to live in a society where women are allowed to have a day off when they have their period, because women are not men. And just by admitting that doesn't mean that we are weaker or less able to cope in the world, but it means we're different. And I think that we shouldn't have to live in a world that's entirely 1,000% catered just for one gender anymore.
In life, it's normal to have ups and downs. But what do we do when we get stuck? I've always been fascinated by the healing journey. Why do some people get better while others fail to make the shift? Welcome to the Season 2 Expert Series, where you'll meet 24 of the world's leaders in health discussing their passions and what it takes to make a shift.
We tend to be our harshest critics.
We are more than the muscle and bones in our body.
Whoa, that's so opposite of what I was taught growing up.
I would like a call to arms for women to know that their intuition isn't lying to them.
I'm Catherine Maslin, and this is The Shift. Hi, I'm Catherine Maslin, naturopath, author and host of The Shift. In the Expert Series, we share the insight, stories and expertise of each of our amazing experts. We're talking doctors, authors, naturopaths, researchers and thought leaders. You may have heard them on Season 2 of The Shift, where we took snippets of these interviews to put them together in the series for you. If you haven't listened to Season 2 yet, I'd highly recommend checking out Episode 1, which will give you an overview of what constitutes women's hormonal health and a sneak peek into the series. We'll provide a link in the show notes. Dr. Peta Wright is a gynaecologist, paediatric and adolescent gynaecologist, and fertility specialist. She is the founder of Vera Women's Wellness, a holistic and nurturing gynaecology and fertility practice based in Brisbane, Australia. Peta has helped hundreds of women with pelvic pain and endometriosis, as well as polycystic ovarian syndrome, hypothalamic amenorrhea, vulval concerns, painful sex, abnormal pap smears, and much, much more. She is the author of the soon-to-be-released book Healing Pelvic Pain, a speaker and advocate for holistic women's and adolescent health. It is Dr. Peta's dream to help women remember the beauty and power in their own bodies and to give them back the tools and knowledge to live happy, healthy, and empowered lives. This is a great conversation and I hope you enjoy it as much as I did. Let's begin. Dr. Peta Wright, thank you so much for joining me today. I'm really excited to chat to you and get into some conversation. But before we do, I would really just love for you to tell us who you are and what's actually brought you to where you are today.
Thanks, Catherine. Thank you very much for having me. I'm excited to be here. So I'm a gynaecologist, fertility specialist. I think that one of my most important roles is as a women's health advocate, so advocating for women's bodies and the knowledge about their bodies that I don't think they have received. I did fairly standard medical training in Melbourne, trained in the Northern Territory before finally getting to Brisbane and doing obstetrics, so delivering babies, gynaecology, and then getting into fertility a bit later on. And I probably in the last 4 years, I would say, I can mark it with when I had my baby, who's almost 4. And especially as I was in private practice, probably for the last 6 years, I would hear the same stories from women over and over and over again. And it was this lack of knowledge about their bodies, about their menstrual cycle, what was happening inside them, coupled with a lack of knowledge about treatments that were prescribed to them, particularly hormonal contraceptive drugs and things like that. Many women would be on them for 10, 20 years and have zero idea about how they worked or what they did, and were always shocked to understand what was happening in their body and how some of those treatments affected them. And I also, after seeing many, many, many women in my practice, came to understand the importance of their life events that can present with pain and other hormonal difficulties. And so I taken a bit of a turn into practicing more integrative medicine and gynaecology, focusing a lot on diet and lifestyle factors in managing lots of the conditions that I was taught to traditionally manage, mainly with hormones and drugs and surgery. And I also work with an amazing community of other women's health practitioners like physiotherapists and naturopaths and dietitians and psychologists and hypnotherapists and all sorts of beautiful women who I think are invaluable to helping women along their journey.
So like a lot of the experts that we've had on the shift, it sounds like for you, you kind of went through that traditional medical model, was practicing in it, and there was this turning point. And you mentioned the birth of your son. Tell me, what was going on for you at that time? What were the decisions that you were making or the things that you were observing that made you make that shift?
Looking back at that, I was on the pill for about 20 years, I think, since I was probably 17 or 18, like so many women are prescribed. And I remember when I was learning gynae, my teachers and mentors would tell me when a woman would ask, oh, is it a problem to be on the pill for a while? The standard answer, and the one that I learnt from my mentors and teachers, and the one that I would go on to say to women, and it makes me want to cry when I think about this now, was everybody's on the pill, and if you surveyed female gynecologists, nearly everyone would be on some kind of birth control, because why would you want to have a period when you can be clever and turn everything off? Unless you're actively trying to get pregnant or you are pregnant, of course, all of these female gynecologists are on the pill. That's what I would say. And I went off the pill, and I think that going off the pill, I felt this happens to many women, not all women. It doesn't affect them, and sometimes going on the pill is helpful for mood. But for me, I had this feeling like I felt like myself again, which was a really bizarre thing. And many women I know will resonate with that because I've heard that time and time again. That was a big turning point for me. The other turning point was my Jude was about a 7 or 8 months old. I was going to Canada to a menopause conference. It was the first time I was going to be away from him. And in the airport bookshop, I picked up a copy of Dr. Lara Bryden's book, The Period Repair Manual, read it cover to cover, made notes in it on that flight. When I landed in Vancouver, I emailed her and said, oh my God, this just seeing all of everything you've written in print is amazing, and I can't believe someone else thinks like me. And it was incredible. And that was a turning point as well.
So quite amazing, because obviously you have colleagues and a lot of people around you that there really isn't a lot of uptake for these what we would call fringe ideas, things like that lifestyle might affect your hormones or fertility and that kind of thing. How did you navigate that as a doctor, kind of going, okay, well, I want to take this different path, but the people around me potentially don't agree? How did you navigate that to move through it?
I think it was just that as I was seeing women, it wasn't good enough so the status quo with how gynecologists and doctors treat a gynecological symptom is, whether it be pain, irregular bleeding, hormonal issues, is to fix the symptom. And that's how you get taught in medical school. And because my brain's very curious and can't just deal with that being the answer, I would want to know why, what's the root cause of what's happening for this person. And just using a treatment like the pill seemed like a Band-Aid solution. It wasn't getting to the bottom of what was actually happening in that person's life. And it would come often with side effects and other things. And it just didn't seem like an effective or good enough solution. So it was that curiosity and also wanting to get to the bottom and the root cause of the women who came to see me, their symptoms, so you could make real lasting change that propelled me to, practice more of this sort of root cause medicine. It was, I think, scary for me when I realised I'd had a real paradigm shift in my way of thinking, and I couldn't go back. I couldn't unsee what I had seen, if that makes sense. So I couldn't practice that old way anymore. And it was confronting for me around some of my colleagues and things who hadn't had that paradigm shift. I guess it was a little bit scary to practice that way, but at the end of the day, my job is to advocate for women. And I believe that empowering women with what's actually happening in their bodies, getting to the root cause of it if that's what they want, and making sure they understand side effects, risks, exactly how treatments work and the options available to them to address their problem is worth more to me than acceptance from colleagues, etc. Plus, I think that the tide is turning. And so, I work with many amazing gynecologists now who I think are starting to understand perhaps that old way of doing things is not the best for women. It's not really women-centred.
Absolutely. And you mentioned kind of the tides turning with this, and definitely there's some change there. So how do you see the state of the medical system right now in Australia, and what are some of the positive changes that you're noticing?
Well, I'm not really noticing any positive changes in the medical system. I think that what is encouraging to me is that there are more and more gynecologists and practitioners who have reached out to me and said, I've noticed or I've heard that you're doing things a bit differently, and I'm also feeling jaded, and I'm also feeling like there's got to be a better way. And the fact that those younger doctors are reaching out and wanting to learn a different way and a more root cause approach is encouraging. I think because of that, those young doctors are going to be the mainstream medical workforce that changes things, and then that's how policy changes. So I think it will happen slowly, but that's the thing that encourages me. I still feel like it's difficult in a public system. I feel like the medical system overall is very, very, very focused on you're sick already, now let's do something about it, rather than a preventative model of care, which it frustrates me no end, rather than, focusing on someone who might be pre-diabetic on that road to diabetes, as an example, and only doing something about it when they do have frank diabetes or a full-blown condition. Frustrates me a lot, the fact that a lot of preventative medicine, like going to see a naturopath who actually can spend the time to deal with all of the lifestyle things that are the cause of many of our chronic conditions that we see in Western medicine, and they don't have any Medicare funding anymore. It drives me bananas when GPs have only got 15 minutes to see a patient, and they're doing their best, but they don't have the time to spend on preventative medicine and lifestyle often. So I think that that's a really broken part of the medical system. I, up until very recently, was working in a public hospital as well, doing adolescent gynaecology, so gynaecology for young women. And I found that a frustrating experience because I was seeing lots of complex women with pain and hormonal dysfunction and ovulatory dysfunction and things like that. But no matter how hard I tried, I couldn't get funding for physiotherapy and psychology and those kinds of services which would really help. And the things that were being pushed were surgery because it pays the hospital money, and medications because it's the quick Band-Aid fix. So I found that I personally couldn't keep banging my head against a brick wall in that particular circumstance anymore, which is obviously sad that I kind of bowed out, and I felt upset that I'd given up in that realm, but I felt like I could do more good in another way.
And I think too, like, talking about it is one thing. And what I love about your approach, and I want to talk about the new clinic that you've got coming up as well, is the collaboration. So a lot of doctors would go, okay, well, there's something missing, so I'm going to go and study nutrition and I'm going to become integrative and do it all, right? And still in kind of quite a shortened consult time, whereas you've really identified, I do what I do really well, but there are these other elements. I'm going to bring in physiotherapists, I'm going to bring in naturopaths, I'm going to actually round that out. And I think that's really powerful. So tell me about the clinic that you're creating out at Samford Valley here in Brisbane.
So many of the women that I see are chronically stressed. There's a lot of chronic persistent pelvic pain, hormonal issues that are often driven by lifestyle factors like diet and stress and lack of sleep. And the common theme for many of these women over time is that they don't trust their bodies. They feel like their bodies are broken and that need to be fixed by someone or something outside of themselves. They've lost total connection to themselves. If they do suffer from a condition like chronic pain, they're not able to find any joy or pleasure or anything in their bodies. And I feel like having a place that provides space and time for women to be able to tell their stories, I find that especially when dealing with women with pelvic pain, often women have difficult histories of trauma, and that might be sexual trauma, it might be bullying, it might be all kinds of emotional trauma that they carry around in their bodies and have been not processed. And that, to me, is a big player when it comes to chronic pain. And in order to provide time, space, setting for women to be able to talk about that and start that healing, which can hopefully then help their pain, I wanted to be able to create a a space that had space, nature, time, somewhere that women could go to connect to themselves, to connect to nature, because I think that nature is a really healing component as well. So my clinic will be multidisciplinary, so some integrative gynecologists like me, physiotherapists, psychologists, acupuncturists, dietitian, natural medicine, and who knows what else will come along as we progress. But I envision it being more than just a clinic, but creating a safe, inspiring, empowering place for women that is a community of women to, reclaim their knowledge about their bodies, which we've always had, but we've forgotten.
Sounds like a wonderful place to heal. Let's talk about pelvic pain, okay, and chronic pain type syndromes. Tell me what you're seeing in your practice at the moment and, why you think so much of this is happening.
I see so many women with pelvic pain, and that might be due to conditions like endometriosis. Sometimes it's not endometriosis, but it still has the same effect on quality of life for women who suffer that kind of pelvic pain. It may be related to periods or also unrelated to periods. It might start as period pain and then become pain that is, nearly every day. It can be incredibly debilitating, and I'm seeing it more and more and in younger women as well. I think that pain is incredibly complex because there's not usually one driver of pain, and I think the old way of managing pelvic pain, so for example, when I was training, it would be a woman would come with pelvic pain or pain with their periods, and the way of treating it would be, okay, is it endometriosis? Let's do a laparoscopy and see. So that's keyhole surgery, which can diagnose endometriosis and remove endometriosis deposits. If the woman had no endometriosis, they would often be told, no, it's not endo, it's something else, maybe gastro, see you later. The woman's pain would not be addressed at all, and they've still got pain. Just, whether or not they've got endometriosis is kind of irrelevant when they still continue to have pain. If they did have endometriosis, it would be excised, and then maybe the woman would be put on the pill or have a hormonal IUD recommended, and that would be pretty much it. I think our understanding of endometriosis, although it's there's lots more questions that are unanswered as to what there are answered. Even if someone has endometriosis as a cause for pain isn't the only part of the story. There is, it may be a driver to pain, but there is then upregulation of pelvic pain pathways, something called central sensitization. When the brain becomes used to receiving painful messages, those messages can be amplified. So neurons in the brain can be wired to receive pain and to cause pain. There may be pelvic floor muscle dysfunction. So as a result of that painful stimulus, the muscles in the pelvic floor become tight, dysfunctional, and go into spasm more often. And that can be a really common cause of pain that's often undiagnosed. And then there's obviously a huge link between gut health and endometriosis and pelvic pain, and they're not separate entities. And then there's the emotional aspect of things too. So things like trauma, which I touched on before, not feeling safe in someone's body, in a woman's body. So if they had a sexual trauma or have been unable to express emotions in the past, often that can be sort of trapped as energy in the body, and that can be a big source of pain. So teaching a woman how to feel safe in her body, relax those pelvic floor muscles, can be huge when you're talking about strategies to deal with pain.
It's not just about endometrial tissue causing inflammation, right? It's not just about something that's irritating or something specific. It can be like the muscle memory and things tightening up. It can be the emotion and the trauma and that side of things. Because for most women, as you said, the journey is they go to the doctor. These days usually might go and get further investigation. But, 20, 30 years ago, it was just like, well, no, it's just in your head or it's normal, just deal with it, I guess. Is any amount of pelvic pain normal?
On numerous surveys and things, more than 90% of women will report some pain with periods. And I would say that pain that occurs on the first couple of days that is manageable with simple analgesia, So Panadol, Nurofen, ginger, something that I often recommend, other supplements, stretches, hot packs, etc. Pain that doesn't dreadfully affect your quality of life can be normal, okay? But if it is going on for the whole period, if it's severe and debilitating, you're not able to get out of bed, you're not able to do things that you normally would do, and it's accompanied by other symptoms such as pain with sex or pain when you go to the bathroom or other things like that, then you definitely should seek early intervention. I think the key is about if you're having any degree of pain that's interfering with your quality of life and making you not able to live the best life that you want to live, you should seek help. And that could be from a gynaecologist, could be from a GP, could be from a natural medicine practitioner, just someone who can intervene and give you some strategies. I don't think necessarily everybody who has bad pain needs to go straight for a laparoscopy. I don't think that's often particularly helpful. That is part of the jigsaw of treatment for some women. I don't think that it's necessary for all women.
Want to look deeper into your own health? Our virtual naturopathic team help people all over the world to shift their health and their lives. We offer a 90-minute online discovery and diagnostic session where you can find out where you're at, why things are happening, and what you need to do about it. Everyone is an individual, and sometimes it can help to have someone break down your journey and see where you need to head next. To find out more, go to theshiftclinic.com and click on Clinic. What's the first step for women who are experiencing this chronic pelvic pain?
I think the key is, first of all, before it becomes chronic pain. So I think it's important that early intervention, because we know that if someone is exposed to painful stimulus over time and repeated painful stimulus, chronic pain is more likely to develop. And that's when, say, a woman starts off having progressively more painful periods, and then she starts to have pain on most days, even when she doesn't have bleeding. I would ideally want to see someone before that happens, okay? Because you don't want those pain pathways to start to be primed and upregulated, because it's much easier to deal with things before that's happened. So I would start by perhaps seeing a GP. The trouble is that there are lots of ways to treat that pain, and I think the thing is that many women only know that there's Panadol, Nurofen, and hormonal contraceptives. So I think the key thing is probably to understand, first of all, what's causing normal period pain, because I think that's a big thing, because fear of when a woman has pain and you can't see it, would be lovely if you had a little window into your pelvis so you could see what's going on, but we don't. And there is a lot of fear associated with pain, because pain is supposed to be generally, it's a sign that our body's telling us something's wrong, that we need to do something about it. Normal period pain is when the lining of the uterus is shedding and we're releasing things called prostaglandins, which are little chemicals that irritate the nerves inside the pelvis. The other thing that happens is the uterus contracts, and when that happens, as it's a muscle, oxygen levels in the muscle fall. It's a bit like having a stitch. So they're probably the two main causes of pain when someone has a period. Obviously, if a woman has more prostaglandin, they can have more pain. If they've got more inflammation in their whole body, they might have higher levels of prostaglandin. If they've got more sensitive pain receptors, they might, experience more pain as well. And then there's the emotional side of things. And then there's the pelvic floor muscles as well that can lock up. So there's quite a few aspects to period pain. And so I would work initially on trying to educate a woman about what is causing that period pain, and then focusing on some of the strategies to reduce those prostaglandins, relax muscles, downregulate pain pathways, and start there. So I think it's important that women understand that there are other options besides the pill if they're wanting another option, like addressing the root causes of some of those physiological reasons for pain we've talked about. So I would see a gynaecologist, see what's happening with the gut, see what's happening with bowel motions, diet, lifestyle, all of that. Some of the ways of reducing prostaglandins can be through diet. So an anti-inflammatory Mediterranean-style diet would be what I would recommend as a starting tool. So I would be eliminating gluten and dairy. So I'm often working with a dietitian or a naturopath to really look at specific things that could be affecting that particular woman. Reducing sugar, processed foods, inflammatory seed oils, that kind of thing. And then some supplements can be helpful. So I always recommend zinc and magnesium because they can reduce those inflammatory prostaglandins. Fish oil can increase anti-inflammatory prostaglandins, which can be helpful. Curcumin, the active ingredient in turmeric, can also help. And then dealing with the pain by using all of those things on a daily basis to reduce inflammation, and then working on those when they get those pain flares. So stretches, if they've got a degree of pelvic floor upregulation, then I would get them to see a specialised pelvic floor physio. That can often make an absolute world of difference. I've seen women who have had bad endometriosis, have laparoscopic excisional surgery, but the physio is a huge part of it because a lot of that pain response can be due to those pelvic floor muscles. We often don't have any awareness of that unless they are super tight. But then because it's such a vague pain, no one ever comes to see me and says, I've got pelvic floor pain. It's always, I've got pelvic pain. So that's another thing. I would talk to women about the other options, so hormonal therapies, which can help. So things like the Mirena IUD, if their periods are a big trigger and nothing else is working, or they're wanting contraception or they're wanting a hormonal treatment, because a hormonal treatment can often reduce bleeding, which then reduces the prostaglandins as well, which is a big part of the pain. So things like the Mirena or the Kyleena, which is a progestin-containing intrauterine device, which basically works to thin the lining of the uterus, so it inhibits the growth of endometrial cells. So the lining only is thin, it doesn't build up and get thick, and it often you reduce often down to nothing or really reduce it to a very minimal amount of bleeding of those endometrial cells, so you're not getting that continual inflammation and release of prostaglandins.
Can you tell me more about the Kyleena? Because that's fairly new on the market, right?
So it is much like the Mirena. So it is a progestin-containing intrauterine device. It's a bit smaller, physically a little bit smaller, and it has a lower dose of the levonorgestrel, which is the type of progestin that's in it. So it works in much the same way. It's been marketed specifically to women who haven't had babies before because of its size. However, it has a lower rate of achieving amenorrhea, so a lower rate of having no periods completely. So many women, more women than who have the Mirena, will probably have a light period each month that doesn't completely go away. And because, of course, it's only just come out, we have been using the Mirena in women who haven't had babies forever as well, so it is also completely safe. So I would just be having the discussion with women about the fact that it's a slightly lower hormone dose, it's slightly smaller, so it might be more appropriate if a woman has a smaller uterus or has had issues with pain or cramping with the Mirena, or wants to have a regular bleed even though it's light. I would probably err more on the side of the Kyleena, but for many of the women that I am using something like that for, they're generally wanting to have no periods if they can, so I'm still using the Mirena quite a bit. And then the pill is another option, which, to be honest, I don't prescribe a lot, but the pill works by suppressing ovarian function at the level of the hypothalamus in the brain by turning off the reproductive system altogether, stopping ovulation, which stops the release of prostaglandins at that time, and also thins the lining of the uterus out. And, many women who have endometriosis or period pain can skip their withdrawal bleeds when they're on the pill, so they're minimising or skipping bleeding altogether, which is going to reduce the prostaglandins and things like that. I find perhaps women that come to see me have often tried that, or they've suffered side effects with the pill, or they don't like the idea of turning their reproductive system off entirely. And so I probably tend to use more of the local progestin therapy, like the progestin-containing IUDs, but it's certainly an option for some women. I think it's just important that whenever a woman chooses to go on the pill or have any form of hormonal contraceptive drug, that they understand exactly how it works and potential side effects and risks, and that if they do have any of them, they can address them early so that they're not on something for years and years and have a side effect that they didn't even know was a side effect. That can be a problem. And I also think, starting young girls on the pill, within a couple of years of having a period has its whole other set of issues.
Tell me a little bit more about that, because obviously you worked in adolescent gynaecology, so you've seen a lot of these young girls that, are going through this stuff. What are the risks of putting a young girl on the oral contraceptive pill or other forms of hormonal contraceptive when they're that young?
If a young woman and their mother came in to see me with a period problem, such as pain or any other problems, and they're considering the pill, the things that they need to know are if the pill is started within a couple of years of first getting a period, at that time, the brain and the ovaries system, that's only just starting to develop. It's not fully mature, and it's not actually fully mature for 8 years. But many women will have irregular cycles for the first couple of years while their brain and their ovaries are just figuring out how to talk to each other. Because the pill stops the brain and the ovaries from communicating with each other, it basically cuts off that communication so that it's not able to practice. So what I see a lot of is women who have been put on the pill at 13, a year after they've had a period, perhaps to regulate their cycles, which is like my biggest bugbear in the whole history of the world, because it doesn't regulate your cycle. It just turns everything off. And then these women think, oh, it's fine because now I've had regular periods since I went on the pill. But they're not having a regular period. They're having a withdrawal bleed. They're not ovulating, and their bodies are just, their ovaries and their brain have just turned off. And when I tell women like that, who are sometimes 40 years old, they're completely shocked that that's been happening, and they've had no idea, and they've been thinking that they've been having a natural period for the last 20 years. So the danger is that if your brain-ovary connection isn't well developed, if you then stay on the pill for 15 years and you go off it when you're 35 and you've had a brain and ovary system that hasn't been able to practice and reach maturity and be able to reach that beautiful fine-tuning of ovulation each month, when you go off the pill, that's when I see women who might notice that their periods don't return normally. Their brain and their ovary has to learn how to communicate with each other again, and that can take some time. And you might not have that time when you're 35. And I see this, and then these women are impatient, of course, because they want to have a baby, their clock's ticking, and they're then fed right into the tunnel of IVF and fertility treatments, which they may not have ever had to have if only their bodies were able to mature, because they don't have a mature reproductive system at that point. The other ones that I think there's increasingly more evidence for is the effect of the pill on our brain development. So we know that the brain isn't fully developed and matured till we're about 25. We know that adolescence is a really crucial period of time where the brain organises and matures. And that's in response to hormones, so testosterone and estrogen and progesterone and all of those things. And I think we're only just starting to understand how those hormones actually affect the brain. There is some evidence that going on the pill at a young age in adolescence is associated with depression and anxiety, and that risk can continue even when young women go off the pill in their 20s, and it may be changing the brain permanently. There's also evidence that it changes the way our stress response is wired, so that women who are put on the pill may be taking less risks because we don't have the effect of testosterone, which is like this hormone of confidence and agency and all of that, and we don't have that. I think that's really important for women and their mothers and their fathers to understand. And I've seen multiple women who have been on the pill or about to go on an antidepressant and then made a connection and then have gone off their pill and been fine and haven't had to, go down any other treatment for depression. So it's important that women understand that this is a possibility, that their moods and how they feel in their bodies can change, and that if they are feeling that when they're on the pill, that they can recognise it and trial going off it. If they go off it and nothing's changed, then it's not the pill, but it could be. And so it's important that they understand that.
So there's a couple of conversations in there. One of them is around, I guess, just the medical model and the culture of everything. And I remember I got invited along to it was like a one-day seminar for GPs, I think, but it was run by a fertility clinic, and I went along to it. But I spoke to a few of the specialists there on that day, and I was like, what do you think about giving young kids the pill, if they have period pain or whatever? And he was genuinely just like, we don't have anything else. I don't want to, and I know that it's causing damage, but I just don't have anything in my toolbox.
But you do. I know. I used to think that, but there's so much more. And I've seen I see women like this all of the time who maybe they go to the doctor and they're recommended the pill and maybe mum thinks, I don't feel quite right about it. And so she'll come and see me and we talk about all of the things. It requires a lot of time, which I don't think our medical model gives women to understand, to educate. That's huge, right? Because if a woman has got pain and they've got a fear associated with that pain, it's actually okay to have some downtime around your period. That's another thing that's probably a controversial opinion that I have, but this idea that women have to power on, that question of do you have any days off from school or work or whatever when you have your period, I actually would like to live in a society where women are allowed to have a day off when they have their period, because women are not men. And just by admitting that doesn't mean that we are weaker or less able to cope in the world, but it means we're different. And I think that we shouldn't have to live in a world that's entirely 1,000% catered just for one gender anymore.
Is it a paradigm shift, or is it just going back to our roots and what we used to do as women, you know, having women's circles, you know, having that red tent and taking that time?
It is. That's the thing. It's an uncovering. And this is the thing. Women have always known this stuff about themselves. But patriarchy and our culture that has basically raised women to not even mistrust our bodies, but basically to hate our bodies, to be ashamed of our bodies from the very first, from basically puberty onward. You know, you have a little girl, I think, don't you? Mm-hmm. I have a stepdaughter, and you're seeing your kids from these gregarious, beautiful, confident children, and then the puberty hits, and then that's shame, not liking their bodies, everything's wrong with their bodies, women thinking that they have to be this one thing, that there's constantly something to fix. That's a huge part of it as well. We know, I think, deep down that we're beautiful, amazing creatures who have a hormonal cycle that's not 24 hours like men. And we did have that way of connecting with each other and with ourselves in the past with women's circles and slowing down and being with the rhythm of nature in our bodies, which we've lost because we've been forced to toe the line, live in this world that just worships that 24-hour productivity at all costs model. And I think we need to reject that.
You've been working with women with fertility for quite a long time. Tell me, what are you seeing with the way that women's health is generally in regards to their fertility? Are you noticing that things are increasing or getting worse? What patterns and themes are you noticing?
Well, the obvious one is women not having babies until later in life, which is always a difficult one. But I think, again, that comes with understanding how our biology works, how, you know, the things that affect ovulation, which is essentially our fertility, right? So fertility is just a reflection of our underlying state of health. I feel like many women, they often go straight from hormonal birth control, which they've been on for many, many, many years. They don't know anything about their natural cycle or ovulation or anything. And so when they start to try for a pregnancy, they're really learning right from the beginning the basics of what should be happening in their bodies. You know, there's lots of technology now, like period tracking apps and other things that can help women. But sometimes I think that that's actually another layer which disconnects them from their bodies, because they might come and see me and they'll say, yeah, I've been ovulating. My app says I'm ovulating here. And I'll say, but have you noticed any signs in your body? Have you been doing your temperature? Have you been noticing your cervical mucus? Have you been noticing the way you're feeling? And they're like, no, they're still disconnected from their body because they haven't learned those signs. And I would love it if, as well as learning about contraception for our young women, that they were also taught about fertility and about why ovulation and healthy cycles matter, not just for fertility later on, but also because of the health-giving effects of hormones and things like that, when we're making hormones monthly. But because the status quo is just hormonal contraceptive until you decide you want to have a baby, they don't get any of those messages at all. So I guess the waiting till they're older, effective hormonal contraception. Again, I see women who are often doing lots of exercise, often under eating, having hypothalamic amenorrhoea, which is where their brain sort of shuts off the signaling to the ovaries, and they're struggling to fall pregnant because of just not understanding how exercise, diet, stress can affect our ovulation. And again, living in a society that rewards constant doing, and fitting into a, a box with size of how your body should be and things like that, and not nurturing and listening to their bodies. So I generally encourage women to spend some time, if they have it, to get to know what's actually happening with their own cycles. And if you are using a contraceptive hormonal drug, to maybe go off it a few years earlier than when you want to conceive, so that A, you can learn how to track your natural cycles, and also you can start to uncover if there is a problem. If there is a problem with your ovulation because, say, underlying polycystic ovarian syndrome or endometriosis or any number of other things, there's actually time to address it and potentially fix it without going to IVF. I'm also seeing a lot of male factor infertility with sperm counts dropping. I think that's standard across many industrialised countries, probably because of our environmental exposures and things like that. But men don't get any education either about how their fertility, their sperm health, is a consequence of their underlying health.
Can I ask a huge favour? If you like this podcast, the very best thing that you can do to support us is to leave a review on Apple Podcasts or a rating on Spotify. This will help to push us up in the charts, which gets us into the ears of more people just like you that are also trying to make their shift. Tell me a little bit more about the impact of over-exercising and calorie restriction on fertility.
So I see this so often, and it's actually one of the most difficult things to treat, because often some of these behaviours, so calorie restriction and over-exercising, because we live in a world where social media tells us that, especially our young women who are exposed to this stuff on a daily basis from really, really young age. You know, even pre-pubertal girls now are not liking their body and thinking that they need to be in smaller bodies, which is just terrifying. And so under-eating, not consuming enough calories for your body. So the hypothalamus is like the CEO of our body. So it manages all of our hormonal systems, including our reproductive hormones. So the hypothalamus takes in information from the environment. So it takes in information like, is my person getting enough calories? Is it getting the right kind of calories? Is it getting enough protein, enough carbohydrates, and enough fat? Is it stressed? And that could be physical stress, so over-exercising, could be psychological stress. And it takes in all of that information and it will do a bit of a calculation. So if you're under-eating, exercising too much, it will say, okay, there's a deficit here, and because reproduction takes a lot of energy and it's going to result in a baby that requires a lot of energy. And unlike kangaroos who can start a pregnancy and then find that they're in starvation mode, there's not enough food around, they can halt the pregnancy and the little Joey can just kind of sit there in like a sort of static position until there's adequate calories around, and then it can regrow. Yeah, which is really cool. People can't do that. So because humans can't do that, the brain is really clever. So I think the key thing to remember is if you're over-exercising or under-eating and you stop getting your periods, it's not like there's something wrong with you. Your body is very cleverly and intelligently protecting you. It's making a really wise decision that your body can't handle a pregnancy right now. So it just switches your reproductive system off. So it stops the hormones from your brain to your ovaries to release an egg. And so that's what it does. And women need to get 2,000 calories a day just to live before you do exercise. So I think it's really important to be listening to your body, nourishing your body with healthy, real food and not restricting. And if you notice that you are getting into a lot of exercise or you're changing your diet and your period does go off. This is why I think the period is such a valuable sign for health. And in fact, the American College of Obstetrics have written a paper on it saying that the period should be a vital sign of health, especially in adolescent girls. If you are doing any of those things and you find that your period goes missing, you can recalibrate and say, oh, okay, maybe I need to back off on the CrossFit 7 days a week. Because I see this and I see that this is ingrained, and these women come to see me, they have no body fat, they do CrossFit, 6 days a week, really under-eating for what they're doing. And then combined with that, they may be not sleeping as much, having stress at work, they've not got their period. Now, because those pathways of the endorphins from exercise, the firmly held beliefs about how their body should be, the fact that they've not listened and they've not trusted their bodies such a long time, it's incredibly confronting and difficult for them to change their behaviour. And so you can say you need to eat more and you need to exercise less and you need to do just yoga and walking. It's so hard. And often with those women, I would recommend actually working with someone to psychologically support them at the same time, and or a dietitian as well, because that can be incredibly hard. And I could count on like numerous fingers the number of women who've just hated me when I've said this to them. They'll say to me, I just give me IVF treatment, give me fertility drugs, and often they're much more likely to want to do that rather than get their bodies back on track. But to force something that their bodies are saying is not safe. But the number of women who've come to see me after 3 months or so of doing that, and they hate me and they're like, oh, I hate you, and my period still hasn't come back and I've gained 5 kilos. And I'll say, okay, let's do a scan. And, you know, the number of times they've been pregnant, or I can do a scan, and so the reason why they haven't had their period is because they're pregnant, which is great. Or we do a scan and we can see that the lining of the uterus is thickening, which tells us they've got estrogen, they've got a beautiful follicle, helping them to reconnect with their body by actually seeing what's going on. Like, I love that bit about my job, so that they can see their ovaries just doing nothing, and then in the uterus just like a little thin little line, so no beautiful juicy endometrium. And then they can see with those lifestyle changes that that's all changed and that their body's working again, and they can then start to trust it. Is amazing, but it is very hard to change, which is why it would be so good if we could change that early and have young women understand how those things affect their cycles, and especially in schools where they're doing, you know, exercise 5 days a week. And my stepdaughter's school, she was telling me, the sports teacher says, oh, sometimes people lose their periods, but it's fine. It's not fine. It's a sign that you're overdoing it. It's absolutely not fine at all. And there's so many examples now just in the last couple of years of elite athletes actually using their cycle to train, and using, you know, the first part of their cycle where there's high levels of estrogen, which is an anabolic hormone, so it helps to build muscle, and doing more of their high intensity training then, and more of their slower weight stretching in the luteal phase, rather than seeing it as a weakness, but actually using it for the magic superpowers that it has throughout the different cycle, and going, if our athletes are losing their period, that's a problem. That's a sign of an energy deficit, or, you know, too much exercise, and we need to fix that.
What I would like to ask you is, what has been the biggest shift that you've had in your life, and what did you learn or discover as a result?
The biggest shift that I had in my life was having my baby. Like many women, I was also totally, utterly disconnected with my body, utterly caught up in the size of my body, the whole, you know, exercising, restricted eating, control mechanism of probably lots of type A personalities, and probably a lot of doctors and a lot of women. Like, it's horrible. This is incredibly common, but shouldn't be normalized. And when I went off the pill, and I didn't get my period for 5 or 6 months, probably because I was on the pill for such a long time, probably because I had a calorie deficit that I needed to fix, and then I needed to learn how to trust my body. And then ovulating, and then, you know, realising that I was, you know, 35, 36, realising exactly the same things this is why I'm passionate about this, because I was lucky that, my body worked when I wanted it to work. But I see this happening in women's lives all the time, and it doesn't work then. And then seeing my body being pregnant and letting go of that control that I had, and listening to it and seeing how amazing it was that there was a little person growing in there, despite the things that I'd done to my body over those years. And then having this baby, and that probably really broke me open. And it sounds like a really weird and hippie thing to say, but that was probably a big turning point in learning that this was a story that echoed in so many of the women that I see. And I just wish that I had have had this realisation like 20 years earlier. And this is what I hope for younger women that I see. Yeah, that was a big turning point. It made me find my voice a bit more as well.
I think that's really beautiful. And I think a lot of women, like including myself, would resonate with that, that feeling of having this being inside of you and going with those natural cycles and going through that birthing process and all of that stuff, which is just really how much more natural, and in touch with nature could we get. It's just that reminder that we actually are part of something bigger as well, which I think is really amazing.
And if you just let it be and nourish your body and make decisions out of love for your body, because the number of women I see who just barely tolerate their bodies on one end and then just have terrible self-esteem issues on the other end. If we just let go and let it do what it's supposed to do, feed it good quality food, rest when we're tired, get into nature, have really beautiful connections with the people around us, let it be what it's supposed to be. It's amazing and it works and it's just a miracle. It's incredible. And I think we just need to give ourselves the permission to be women in our society, and we're not inferior. But also, in order to be equal, we don't have to be the same, and we don't have to fit into the same molds that's what a successful man is. So we have to do that. We can be ourselves and still be amazingly successful. That's what I would love to see happen.
If you could give just one piece of advice to somebody that wanted to make a shift in their health or their life, what would it be? It
would be sleep. I think that people are chronically sleep deprived, and that's a huge one, especially young people who are on devices and technology so much more, and they're not getting that sleep that they need. And then the lack of sleep really snowballs into poor decisions the next day in terms of food choices and lack of exercise and mood. And I think that if we could do one thing better, it would be prioritising sleep, going to sleep when it gets darker, having dimmer lights, waking up with the sun, waking up an hour early. That's another thing, especially for mums and busy women, and probably busy dads as well, busy people in general. Getting up a little bit earlier and spending just a little bit of time grounding and connecting with yourself. And I think that's really important because we need to have something to anchor us before we rush out into the world and live from that more unconscious space.
Beautiful. Dr. Peta Wright, thank you so much for joining me on The Shift today.
That's okay. Thank you very much for having me, Catherine.
There was so much amazing information in this episode. Let's review some of the key points and what action you can take as a result of this. The biggest one for me here is that we need to stop masking what is going on and look for the root cause of the issue. While contraceptive drugs have a place and help some women, a whole lot of others take it hoping for a quick fix, only to realise down the track that they never got to deal with the issue at hand. Everything in medicine should be weighed up with a risk versus benefit mindset. And the only way that we can truly do this is by being informed and armed with knowledge to make the right choice for you. Starting birth control too young can significantly impact reproductive development, but also adolescent brain health too. This risk is rarely brought up by doctors, and parents also need to be informed before making choices to help their children. Learning is great, but action is better. Here are a few things that you could do as a result of this conversation in order to help you shift your health and your life. The first one is to get used to having conversations with your practitioners about the risks versus benefits of any treatment offered. Sometimes, even though you don't like the risk or side effects, you need the medicine anyway. At Shift, our approach with this would be to offer support to try and offset any ill effects. An example of this is where I'd give my patients that need to take the oral contraceptive pill a good quality multivitamin, as we know from research that the pill depletes many of our essential nutrients. If you're experiencing pelvic pain, get a diagnosis. The time to diagnosis for women in pain is usually years. Be sure to keep digging to rule out anything sinister. I can tell you that changing your diet will help with pain and irregular cycles, both from reading research and from seeing these changes in the thousands of patients that I've worked with at the Shift Clinic. We know that eating gluten-free can reduce period pain, and that reducing sugar and refined carbohydrates are also helpful. See a naturopath or nutritionist for specific help. Thank you so much, Dr. Wright, for sharing your knowledge with us on The Shift. You can learn more about Dr. Peta Wright at Dr. Peta Wright, that's DrPetawright.com, or check out her clinic Vera Women's Wellness. If you like this episode, please let us know by sharing on social media and tagging Dr. Peta and myself, Catherine Maslin, or the Shift Clinic, so we can hear what you have to say. You can also leave a comment on Spotify or a review on Apple Podcasts. In our next expert series on The Shift, we have Dr. Ailey Cohen. She's an integrative rheumatologist, environmental toxicity expert and author. You'll want to tune into this one.
Coming up on The Shift.
And I think we need to create our own standards because ultimately that'll be healthier for us when we use fewer products and we know more about the products that we actually use. Drinking water to me is one of the most undervalued and most important area of contamination in our bodies. And there's many studies showing from Hong Kong and in parts of India where there's heavy air pollution that there's higher rates of depression, anxiety, and aggressive behavior.
This series is a production of The Shift Clinic. Hosted by Catherine Maslin. Music and sound design by Shade Furlong. Thank you to all of our experts. For more details on them, go to theshiftclinic.com.
We can be. We must be.
The first generation to end extreme poverty.
The generation most determined to fight injustice
and inequality.
The generation that saves the planet
from climate change.
And this is how we will get it done.
The global goals.
A 15-year plan for everyone, everywhere.
With no one left behind.
The global goals are a framework that collectively help us
support the health of our people
and the planet.
At Shift, we are ambassadors for the global goals.
This project supports global goal number 6.
Clean water and sanitation.
Every time you listen
to an episode of The Shift,
we provide a day's access to clean water
for a human in need
in Malawi, Africa.
Water is the foundation to health, and we believe
every human should have access
to clean, healthy water.
So please share this podcast wide
and keep tuning in
so we can impact those who need it the most.